Hi there, welcome to this course. And I think first you should thank yourself for making such a great decision to start building your AI understanding as a healthcare leader. A quick introduction about myself. My name is Neil Majumdar, and for over the last 15 years or so, I've worked at the intersection of healthcare operations and digital health and health informatics and AI across multiple countries such as Canada, US, and Asian countries as well, including I've got quite a bit of exposure to platforms like Epic and Cerner and Allscripts, and also worked with global health systems like Stanford Medicine, University Health Network, Toronto General Hospital in Canada. From an academic standpoint, I'm also a health informatics faculty member at the University of Toronto and the founder of Health Tech X AI Studio. Across Udemy and Coursera, I've trained more than 10,000 plus students in digital health and AI. In this course, I'm going to share some of the real world frameworks and lessons that I've learned working with these organizations throughout the world. Okay, so this course is not just about learning, it's about leading. We move beyond the hype to equip healthcare leaders with true AI fluency. You will develop critical judgment and not just accumulate facts. We will focus on actionable artifacts that will give you tangible tools to implement immediately. And this isn't your generic AI training, it is tailored for healthcare's unique challenges. Ultimately, you will define your role as an AI fluent leader, driving innovation and governance. This approach contrasts sharply with passive information gathering. Now, we just discussed about how this course stands out. Now we'll explore why your typical information sources like YouTube will fall short. YouTube definitely offers a lot of passive watching and generic facts. Information goes in, but it doesn't stick or really apply to your specific context. This leads to information overload, knowing the what, but not the so what. So the ease of consumption that I have seen provides zero friction, therefore zero growth. So this course, however, builds the leadership edge. And through active creation, you will build artifacts then you can use in the next working week, which will developing contextual judgment through rigorous frameworks. We will embrace deliberate friction because hard thinking builds true mastery. Information is free, but the judgment is earned in this world of today. So we have established that judgment and not just information is the key. So, how do we cultivate the judgment? The method that I have introduced in this course comprises of three pillars. It's called artifacts and the frameworks and friction. You'll create tangible deliverables, documents, plans, and tools that bridge theory and real world application. We provide structured thinking through some of the mental models and decision making frameworks essential for navigating complex healthcare AI. As we embrace deliberate friction in this course, introducing challenges to force deep thinking and ensure lasting learning. This kind of rigorous approach, what I have observed with all my students, builds leadership judgment that AI cannot replicate so far. Okay, so just before we dive in, it is important to understand the structure of this course. So this is what you are seeing in the slide here. So this course is built around six critical questions that healthcare leaders increasingly face while dealing with AI. The first three questions focus on strategic evaluation, understanding the leader's role, determining whether AI is actually the right solution for the problem that you are trying to solve, and evaluating the vendor claims. The next three focus on operational governance, preparing the organization for implementation, monitoring AI systems after deployment, and ultimately developing your own leadership judgment. So, based on those six critical questions, I have structured this course into six modules. We start with module number one, where we clarify what AI actually means in healthcare, and just to give you the core concepts the leaders need to understand. Module number two, we focus on identifying the right AI use cases because One of the biggest mistakes organizations make, what I have seen, is approving AI for the problems that should not be solved with AI in the first place. Module number 3 helps you evaluate the AI vendors and solutions so you can challenge the claims and make more informed decisions. Then, in module number 4, we look at the operational reality of implementation, workflow integration, change management, and adoption. Module number 5 focuses on governance and monitoring, which is critical once AI systems are live. And finally, the module 6 brings everything together into a practical leadership approach you can apply in your own organization. Okay, so let's get started. But I would highly encourage or recommend you to watch the introduction video before you get onto the modules.